Good morning, everybody. Wakey, wakey. It's time for Morning Glory. My name is MC Kalia, and I'll be your captain for the next 1 hour, 30 minutes. Let's have this conversation going. Good morning, everybody. Wakey, wakey. It's time for Morning Glory. My name is MC Kalia, and I'll be your captain for the next 1 hour, 30 minutes. Let's have this conversation going. Good morning, everybody. Wakey, wakey. It's time for Morning Glory. My name is MC Kalia, and I'll be your captain for the next 1 hour, 30 minutes. Let's have this conversation going. Good morning, everybody. Wakey, wakey. It's time for Morning Glory. My name is MC Kalia, and I'll be...
Karibu Topil Hospital, a brain and spine specialty hospital dedicated to providing extraordinary care through competent doctors and other medical personnel from premium institutes with knowledge on the latest and exceptional medical technologies. With a capacity of over 70 operational ward beds, over 30 specialists and consulting doctors, Topil Hospital is a modern level 5 facility equipped with 12 state-of-the-art ICU HDU beds and 2 modern HEPA filter theaters with laminar airflow. Our aim is to provide comprehensive quality services at an affordable cost to the community, which includes but not limited to neurosurgery, radiology and diagnostics, MRI, CT scan, X-ray, ultrasound, endoscopy, ECG, EEG, pediatric cardiology, physiotherapy, orthopedics and trauma, pharmacy, laboratory, theater, ICU and HDU, obstetrics and gynecology, general surgery, maternity, psychology, psychiatry, comprehensive wellness checkup, dialysis and urology, oncology, dental care, ENT surgery, nutrition and dietetics. For ease of movement and transfer of patients, The hospital has 2 modern critical care ambulances equipped with ICU facilities and available 24 hours. Top Hill Hospital is located in a serene environment away from noise and has a cafeteria with fresh, nutritious foods, not forgetting ample parking for all clients. Top Hill Hospital is NHIF accredited and accepts medical covers from a number of insurance companies. If you're looking for the best customer care and patient experience and to be attended within the minimum waiting time possible, reach us through the website www.tophillhospital.com or call 0782 121214, or you can also call 0782 900090. You can also email us through info@tophillhospital.com.
It is the first day of March 2023. Good morning to you and happy new month kwa wale ambao tumeingia mwezi wa Machi. So the month of love has elapsed. Just like January did. February has elapsed and now we are in March. And actually, one thing I love about March is at some point we usually have the Women's Day. Yeah, so in a few weeks I will be having the Happy Women's Day. Actually, it's in 1 week. Yeah. So anyway, nonetheless, this is the Morning Glory Show. Welcome to the Morning Glory Show. It is the most comprehensive talk show online in Kenya today, always coming live from Dawi Afrique Photography. And when it's Wednesday, actually, Wednesday is a healthy, wealthy, wise Wednesday. And we've talked about physical health. I don't know if that's what they call it. That's what I call it, physical health. Ile ya nyama. But then we forgot the one for the engine, which happens to be the brain. And so today, Dr. Mwadime from Top Hill Hospital is here to help us understand mental health. In fact, just before the show, somebody was asking me, nikuulize, so inamaanisha mental health, tofauti ya mental health na wenda wazimu ni nini? And I'm sure Daktari will be answering that in a few minutes. I was like, will you be talking about mental health ile ya wenda wazimu? And you realize that as much as it's a topic that is in most people's mouths, so many people don't understand how mental health works, or the difference between mental health and mental unwellness or something, or what does it mean then when you're not mentally well. And so today we are going to talk about depression, we'll talk about anxiety, and also touch on alcohol and substance abuse. But then before we go there, then I must remind you that first, we are the most comprehensive talk show in Kenya, coming live from Dawi Afrique Photography. And I told you about the month of love, February. Now, funny enough, in this region, February is the month of love, but then April is the month of weddings. It is the month of engagements and all that. So if you're planning to do your engagement, so in maybe March, April, May, we shall say March, April, May booking. So that is after kama ukutana na heartbreak in February. It usually happens around katikati ya mwezi pale tarehe 14. So if you didn't meet heartbreak on 14th and we are now in March, make sure hakikisha kwamba jamani you also make sure that you book us for your events. We are here to make sure that you get very nice memories. Nonetheless, allow me to give Dr. Mwadime a chance to say hi to you.
Morning, everyone. Happy new month. I'm Dr. Nathaniel Mwadime from Top Hill Hospital. It's a pleasure being back here again. Yes.
Okay, thank you so much. And Daktari, obviously, the first question is the first question or the last question that had been asked just before I come to studio. Because actually, there was also somebody else who told me, like, you want to talk about mental health? This is something that everyone knows nowadays. Why are you talking about depression? So, first of all, what is mental health?
Thank you, Kalia. Mental health just basically means mental well-being, or the ability to have cognition, behavior, mood, being in the right state. So when we talk about mental health disorders or mental disorders, we just basically talk about those conditions that involve or make a person's mood, behavior, or a way of thinking be impaired in one way or the other. So there are many kinds of mental health disorders. There are an array of mental health conditions that affect individuals out there. You'll be surprised how much mental health is a big issue for a very long time. It's only very recent that we've seen people getting to how can I put it? Getting to hear about it or understand it, but it's been there for a very long time. When the WHO was formed in 1945, and they were talking about health in general, they classified well-being as being mentally and physically fit. In a nutshell, the description is very long, but just in a nutshell, just describing as well-being being both involving mental and physical health. So that's how important mental health has been. So many people try to associate mental health disorders with what one of your viewers or readers talked about, wazimu. Surprisingly, it's not a very common mental health disorders as people might think. Wazimu, or what we call schizophrenia with psychosis, is not a very common disorder. The only reason that people know much about it is because it's overt. By overt, I mean it's out there to be seen. So when someone comes in with schizophrenia, we'll definitely know this person has a mental health disorder.
So you just say that the signs and symptoms are all
are already seen.
Okay.
But with there's the Kenyan task force on mental health in 2020 gave a breakdown of the most common mental health disorders in Kenya, and they basically in that report talked about that there was a staggering figure of 1 in 8 people in Kenya suffering from mental conditions or mental disorders. That's a very high number. 1 in 8 individuals suffering from a mental health condition. And they even went further and said that of the people going to hospital or visiting a healthcare facility, it's an estimated 1 in 4. That's a 25% figure.
And I think maybe before you continue, for lack of better words, you'd remember a cliche. I don't know where you grew up, but when you were growing up, there was a certain cliche that we are all mad. It's just that the level of madness differs. Do you remember that one? Did that ever hit you somewhere?
Yeah, I came across it. I happened to grow up in Coast, so I came across it. Such terminologies that we are all mad. It depends on the level of or degree
of madness actually
that you have. But unfortunately, today I'll be talking about the disorders or the clinical conditions that we actually diagnose in patients. Forget about
the madness you're told.
the madness that you're told, or forget about what can I say, the level of anger that someone can portray or inhibition that someone can actually have. So as I was saying, in 2019 in 2020 they're giving a figure of about 25% of people who visit healthcare facilities as being suffering from one of a mental disorder. That's a very high figure. And then with the coming of the pandemic and the social effects and the socio-economic effects that were brought about by the pandemic, we saw a rise in that number very high, by between 26 to 28% of people actually acquiring new onset mental health conditions. So that number actually rose as a result of COVID-19 and the pandemic. So you can understand how high that figure is. And the figures of WHO in 2019 were giving a figure of 1 in 10 people in the world suffering from mental health conditions. So this is a very important figure. This is a very important condition that is affecting individuals out there. And that is why awareness has become key. And the reason why we are creating awareness is because we've over the years, we've noticed that most people are suffering from different kind of mental health conditions. And because of the stigmatization that has been associated with mental health conditions, the practice of seeking help and seeking professional help per se has become very minimal. over the years. People tend to shun people with mental health conditions. When you find schizophrenic patients or psychotic patients, the ones we call wazimu, people tend to keep them away. People tend to say, let's see what is going to happen. Nobody is really caring enough to try and actually help this person seek help from a health profession. Then other conditions like depression, which was actually ranked the highest in the country in the task force in the 2020 dossier that was given to the president. So they ranked depression as high on the list in Kenya, followed by anxiety disorders, then followed by substance abuse. So you can see schizophrenia does not even rank in the top 3.
Unasema hiyo ndio iko na kidogo lakini that's the one we know most about it.
So it does not even rank among the top 3. So things like depression and anxiety disorders, these were conditions that individuals, for example, men or in the previous years were described as, if you're having depression, you are seen to be weak, you see. So portraying any sign of weakness was seen to be a very bad indicator for your manhood. So you can understand why these conditions were actually shunned. These people didn't want to come out when they have such conditions. They didn't want to be associated with this kind of conditions. So what was happening is that people were suffering in silence. So that is why awareness has become very key. Because the rates of things like suicide are going up in the world and in the country nowadays because of these mental health conditions. And surprisingly, depression is not just the most common condition in Kenya, it's the most common condition in the world because of social and socioeconomic factors that come into play that tip people over to depression. So yes, I'll be talking about depression, I'll be talking about anxiety disorders, I'll be talking about substance abuse disorders. I'm sorry, maybe I may not talk about schizophrenia because of the commonality of it, but I'll also touch a few about it, yeah.
Okay, thank you so much for that, Daktari. Of course, if you already tuned in, let me know where you tuned in from. There's somebody called Chemwan Jr. says good morning. Reborn Nema says good morning. Tune in from Kapsowar. Okay, Ambassador Alfred Sargent tuned in all the way from Perth. Yaka ni ukweli. Anne Potishoi says good morning live from Narok. Then we have Tim Store says good morning from Embu. So we have people all the way from Embu. Of course, I'll be sampling those comments as we continue. I'll also make sure that if you have any question, you ask Daktari. But then Daktari, even from in comparison to other conditions that we've posted before, you'd realize that so many people look or tend to be tired when, like, you're still talking about depression in this age and era. Does it mean that so many people are depressed that maybe it's become now common that people don't what exactly is happening based on at a clinical level when you receive patients? How easy is it to help a patient whom you feel has a mental issue? Because it means that, you see, for malaria somebody would come presenting with signs, then you treat them. Now for depression, for anxiety, of course alcohol and maybe substance abuse, that is something that may be easily you can easily identify. Then how would I really find out that somebody is suffering from depression?
Oh, that's a very good question. So first and foremost, depression just means feeling sad or worsening feeling of sadness and lack of interest in things that you used to do. So in the clinical definition of depression itself, we find the symptoms that come with it. And what we need to understand is feeling sad is can be a common a normal response in when you are feeling aggrieved. Maybe you've lost a loved one, you've lost someone dear to you, or you've had an accident. So that feeling of sadness happens. But the response that we have when something like that happens is that there's a time frame. You go through it, you get to heal, and you get over it. You see. So, but there are individuals who this feeling of sadness goes on for quite a while. So we usually classify people with depression when you're having that feeling of sadness or self-pity or self-loathing for a period of at least 2 weeks. Continuously feeling that way every day, every time for a period of 2 weeks. So when an individual presents with depression, some of the common symptoms that they'll come with will be feeling of sadness, lack of interest in activities that they used to love to do, and they're no longer doing it. We have sleep deprivation or sleep effects that come into play. So either someone will be lacking sleep or someone will be having lots of sleep. Then apart from lack of interest, you have a situation whereby someone lacks how can I describe this? Not being able to do the kind of things that they were actually able to do before. Then you are having, your mood just goes down, some indications, your sexual drive goes down. Then it can culminate in severe effects like suicide thoughts and suicidal ideas that come into play. And some people can even commit suicide. So some of those symptoms that come in when people have depression help us in the diagnosis of depression itself. Yeah.
And how willing are patients that you receive? How willing are they to receive help? Because as I told you, it's just it was so common, because I realized when you see almost 10 people asking you, you're talking about depression in this era, I think it's almost all over. So how willing are people willing to be treated for depression right now, and what would you prescribe?
So the kind of stigma that has been associated with mental health disorders over a long period of time has made it quite difficult to break the ceiling in such conditions. So that is why you see the awareness is getting out there each and every day, everyone talking about mental health conditions, doctors and healthcare workers coming out to talk about mental health conditions, advertisements going on through and through about educating people on mental health condition, because breaking the ceiling has become very difficult. As much as people are aware that this is depression, very few people have the ability to seek help when they notice they have such conditions. The reason being is they still feel stigmatized. You see, individuals still feel that mental health condition is something that they can cope with on their own. They don't classify it as a health condition, as a disease per se. So they do feel that they can get over it without any help. So that health-seeking behavior is not as common or as elaborate as people might think. Still, people are suffering silence. That is why we are still coming out and talking about mental health conditions. We have mental health awareness days. We have the world is trying to educate people each and every day about mental health condition, because the health-seeking behavior is not very common, more so in our setup in this country. So people will be portraying with the symptoms of depression, or someone will notice that he's slipping towards depression, but at the end of the day, they still don't want to seek help, because they still feel stigmatized. They still think that if my colleagues or my friends notice that I am being treated for depression, they will shun me away. They will think I have something wrong with my brain. So still that health-seeking behavior is not very common. So we're still not helping a lot of individuals out there. Someone feels free coming to hospital for the treatment of malaria. Yes, someone feels free when they come to hospital and they have a surgical condition that needs to be tackled. But people still don't feel free coming to hospital to seek help for conditions like depression, for conditions like anxiety disorders, even substance abuse disorders. Someone will think, oh, I'm good, I'm okay, I can handle this on my own. So it still gets worse and worse and worse. That's why you're having suicidal rates going high. Yes. Okay,
and of course, before we talk about the treatment and what happens at the hospital, remember you're tuned into the Morning Glory Show. It is the most comprehensive talk show online today. And also, another part that we may have forgotten to talk about in March and April, as people do weddings, they also need to dress up. And for you to dress to fit the occasion, then D-Square Fashion House makes sure that you get dressed to be addressed. But then if you want to learn how to dress people to be addressed, that means that you want to get into fashion and design, then there's D-Square School of Fashion, Design and Tailoring. So make sure that as we head towards the festive season, visit D Square Fashion House for all your dressing needs, but then also you can visit a D Square School of Fashion Design and Tailoring to train or get some skills on fashion design and other courses that are very interesting. The sweetness of training at a school that has a fashion house is that you get experience. It's like a training in a medical school that has I usually see referrals being close by, so that you get a place to go and do some mazoezi. So the goodness of also studying at D Square School of Fashion Design and Tailoring is that there is D Square Fashion House, and D Square actually custom make their clothes. So that means that you get first-hand experience as you train. Nonetheless, let's continue with treatment for it now. Maybe because also since you've talked about early 20th century, we've been talking about mental health, and I've mentioned before that it's too common that people feel the need to ignore it, but then we continue to see the effects of depression and other mental disorders every day. Could the issue be in the kind of treatment we give so that people are reluctant and they don't see so much effect? What happens in hospital when somebody comes and says, now, I feel niko depressed? What happens next?
So mental health workers are trained to actually make a clinical diagnosis with these conditions. So when we get into a hospital facility and we do notice that you're suffering from a mental health condition, for example, depression, first and foremost, we do have an array of lab works that we do to remove any organic cause that might be giving you such feelings or such conditions. So sometimes there's a small percentage of people who will be suffering from these mental health conditions that actually can be associated to an organic cause. By an organic cause, I mean a physical cause. So someone might be suffering from a brain tumor that is leading to a change on his behavior. So first and foremost, we do a workup. We call them clinical workups or diagnostic tests that will help eliminate an organic cause as being the cause of it. And when we have made sure that the organic cause is not there, so it's a mental health condition, that's where psychiatrists and psychologists come in. There are medications that we give that alter the brain chemistry and help in alleviating these symptoms that the people feel. So there is we call it the pharmacotherapy route, whereby we use medications. Then we have the psychotherapy route, whereby we use counseling and talking to someone to be able to help them understand their condition, to be able to help them accept their condition, to be able to help them cope with it and actually deal with it. So we have those two modes of treatment go hand in hand for almost every mental health condition, whereby we associate pharmacotherapy together with psychotherapy. So pharmacotherapy just means drugs. We, as psychiatric, will prescribe drugs that will help tackle these feelings and these conditions. Because feeling of sadness, everything happens in your brain. So when we give you drugs that alter your brain chemistry, we also help you tackle these symptoms that you're feeling. And then, because the brain is complex in its own way, we need to make you understand what you have. We need to make you accept and come to terms with what you have so that you can be able to cope with every day-to-day life. Remember, these mental health conditions affect the day-to-day life of someone. When you fall sick today, for example, you have diarrhea and you fall sick. When you come to hospital, we give you medication. You'll be off duty 2-3 days, max. Maybe a week if things get very bad for you. Then within a week's time, you're back to work, you're back to your normal self, and you're back to your normal productivity. But for mental health conditions, the treatment period is longer because there's that clinical bit entails pharmacotherapy and psychotherapy. Now, when that treatment period is longer, the effects that come with it are more than when you're having a physical condition. So, and this condition not only affect you, but also affect the people around you. Your place of work will be affected because of your productivity. Your family will be affected. subsequently the community will be affected. So what what people don't tend to realize is that when someone has a mental health condition that is not handled adequately, the effects are, for lack of a better word, devastating to the society. Because take, for example, a teacher who suffers from a mental health condition like depression. So his work productivity goes down, right? If you don't handle this condition. So if he used to, is this a teacher, maybe he's teaching 200 students in his class for a lesson. He suffers from depression that does not, that you don't tackle it. So what happens is these 200 students don't get the product that these teachers can produce adequately. So what happens? These students end up failing in their exams, their academics. This teacher is also a breadwinner, maybe in the family. So what happens? The family economics go down. The school performance goes down. So when you calculate this, all these effects that come about because of one individual, you find the kind of loss that the society has had. There are 200 bright minds that have been affected by the condition of one person that was not adequately treated or was not discovered early and treated in the right way. Those are 200 minds that have been lost. Then there's the family bit and the community at large. So the effect is large as compared to a physical condition. Most physical conditions will just keep you out of work 7 days, you go back to work, back to your normal productivity. That is why it is becoming very important for us to give mental health awareness because of the effects that it gives to
the community
that is there. So the treatment is there, and the idea that this treatment is not adequate enough is usually a misnomer, or what we can call a rumor out there. That does not happen.
Niende kuongeleshwa mimi. Sijaambiwa nini mimi.
That's a rumor out there. The treatment is very adequate. The medications and the psychotherapy that people, the amount of hours that people put into it is adequate to help these individuals. And the good news is that the healthcare workers are willing to help you. They are willing to help the individual that is suffering from a mental health condition. So it's up to us to actually educate you so that you can be able to accept to come. Acceptance is key. And when you find that when you accept, the treatment becomes very nice, that you can go back to your place of work and go on with your life as it used to be. Yes.
Okay, there's this cliche that si depression uko nayo. Ni shida tu za pesa kidogo. Anyway, Daktari tells you that next time you feel sad, make sure you go to a hospital. And you said over a period of time.
Yes,
and you lose interest in the things that you like and all that. That is when you actually go to, you now need to visit a hospital or a therapist or something like that. Now, Daktari, talking about the effects, of course, you've mentioned a few of them. What are the other effects that, apart from the community, what are the effects that now the person who has a mental condition undergoes in case they don't seek help?
So some of the effects, apart from the symptoms that I'm talking about, feeling sad, lack of interest in doing the activity that you used to do, poor appetite, that is for depression specifically. Poor appetite, low sexual interest or low libido, those are the symptoms that you actually experience individual can suffer from with more than one mental health disorder. But in respect to anxiety disorders, anxiety disorders in itself just means excessive fear or excessive worry. An individual portrays excessive fear or worry towards an environmental stimuli or a condition. Let's take, for example, panic disorders. Panic disorders are classified as an anxiety disorder. But it becomes an anxiety disorder when the response is excessive. Now, excessive is usually termed in terms of societal norm. For example, Kalia, when a pen falls down next to you, and maybe you're listening to a lecture, and then, or in this talk show, then let's say a pen falls down, most individuals of the same age with us will either turn their attention towards the pen, just turn your attention on and find out what is just happening, and you go back to whatever you're doing. If you need to help whatever was going on, you'll actually stand up and give the help. But someone suffering from an anxiety disorder will have an excessive response of the same. So what will happen, someone may just jump out of their chair and just continue running or shout so loudly that even the people around will be wondering what's going on. Then you notice, oh,
kumbe ni kalamu tu imeanguka.
Kumbe ni kalamu tu imeanguka. So that now becomes an anxiety disorder. So anxiousness in itself can be a physiological response. Physiological, I mean, it can be a normal body response. In response to be able to help you either, you remember the fight or flight response that people can have. A lion is on the street, or a car is coming at a faster speed, you unashtuka na
unakimbia kidogo.
Una respond immediately. That is a normal response. But it becomes excessive when the stimuli is non-harmful, but your response is excessive. So there's different types of anxiety disorders. You have generalized anxiety disorders, you have panic disorders, you have social anxiety disorders, you have separation disorders that are classified as anxiety disorders. So all these classifications of anxiety disorders usually help us identify an individual with anxiety disorder and be able to classify them correctly so that you can be able to help them when you're managing these patients. Yes. So to answer your question, is there an association between anxiety disorders and depression? Minimal association. Most people who have anxiety disorders might not have depression. Yes.
Okay, of course we'll be coming to what causes anxiety, but then there's a funny question here by somebody who also doesn't want me to mention their names, so I'll not do it. Alisema ajui kama akona depression, neno kama akona anxiety. Let me just get it so that nisisome kitu yenye si mimi. So alisema hajui kama akona na anxiety because alisema at times maybe bills imechelewa and something, and I feel like they're anxious or panicking for the whole day. Would you consider that as an anxiety disorder? What?
If such a condition is going on for a long time, more than 3 weeks, with the same response or different stimuli but having the same response, I'll advise such an individual to seek help, professional help from a healthcare worker. Just come to hospital. We sit down, we talk, we identify the cause, and we also help you in the management of the same. Yes.
Okay. Liz Rockesio says, I'm a victim of depression and it's not easy when you feel you are okay but you are crashing. Thank you to and thank you to a certain group that helped at referral hospital. Thank you so much for that, and that means that also we received that positively, because when people start accepting the fact that depression is real, then it becomes an issue that it is easier to tackle. Now we've moved on to anxiety, and I'll just be asking maybe what are some of the now risk factors or causes of anxiety? What causes anxiety? Now that you've said there's a lot of classifications for it, and somebody here is talking about bills being one of the causes of so what are the risk factors actually?
So per se, the abnormal response that comes with anxiety disorder can be innate. Someone might be that's a normal, someone, for lack of a better word, born with it. It's an innate response that you have because of a response to stimuli. Then other social or other environmental factors come into play. Maybe in your early life you you're tortured in a way, or you experience a traumatic event that makes you edgy each and every time, also can give you an anxiety disorder. So you can be having, for example, a panic disorder just because you experienced a traumatic event earlier in your life. So that anything that triggers an emotion to you, you panic excessively because of a traumatic event that might have actually happened in your early life. So there are different causes of anxiety disorders depending on different issues. Our own personalities can also lead to anxiety disorders. So you can have someone who's an introvert who ends up portraying what we call the separation anxiety disorder, whereby you don't want to be separated from the people and the things you feel comfortable to, because you can easily express yourself in that. So when someone is suffering from either of these conditions, psychotherapy becomes key to help people understand. The keynote here is that most people take it for granted when we talk about psychotherapy. Just talking to someone. So someone will be wondering, why am I going to talk to someone? That is usually the bigger question. Why am I going to talk to someone? And I feel like I can tackle this on my own. The beauty about talking to someone is that someone gives you a different view beyond what you are actually thinking. When you talk to an individual, a professional per se, and you express your feelings, and you express your ideas, and you express your concerns, what you thought is impossible to do or impossible to tackle, someone might give you a different kind of way to tackle the same issue. So the kind of care that comes from psychotherapy encompasses so many things. That is why you see most of these mental health conditions are tackled with psychotherapy. So for someone with anxiety disorders, yes, there are medications that we give to calm people down. If the anxiety is becoming too excessive, we give medications to calm people down. But we also engage them in psychotherapy, because these medications, you don't want people to take them for a long time. So we also engage them in psychotherapy so that we will to understand these conditions. And there are different techniques also of treatment. You have exposure therapy that works very well for people with anxiety disorders. For example, you're afraid of heights, you cannot tackle heights, we expose you to heights and actually train you to how to respond to the same. So with the anxiety disorders, the treatment modalities are many. And when we identify you with an anxiety disorder, we tailor your treatment individualized, because your response earlier might be different from a response of your colleague. And that is why we want to individualize this treatment for people with anxiety disorders as a mental health condition. Yes.
Okay. Thank you so much for that, Daktari. Of course, you realize that the more we get into this, the more you realize that so many people, me included, did not actually have a lot of a separation between anxiety and depression. And of course, I would really be interested to know how easy it is at an hospital setup to realize that, because I don't know how much stimuli you're able to expose somebody to for you to actually find out. Then also, with these mental disorders, because of course it's the brain working, how easy is it for the person going through it to really pinpoint and say, actually, I think I'm anxious? What are some of these things that, apart from maybe the pen, from a personal perspective, how would I know that maybe I'm actually not so well and it is anxiety?
The beauty of the brain is you as an individual, you tend to notice these things on your own first before even someone tells you. That's the beauty of the brain. You can be able to handle environmental things, and you can be able to process ideas in such a way as to be able to identify that I'm suffering from such a thing. For example, you are having excessive response to a stimuli that is abnormal to whatever is happening around you. We are sitting down together here, something happens, I panic more than other individuals. And you've noticed that it happens more frequently. So you come in, you start to question, why am I experiencing this? So ideally, you as a person in that moment, at that state, you've actually helped diagnose yourself. Why am I experiencing this? Why am I responding or reacting differently from my colleagues who are of my same age. We are exposed to the same situation. So why am I responding differently? So the moment you have that question of why am I responding differently, now that is the point that you need to seek help from us, healthcare professionals, because from at that point in time, you've actually helped in the diagnosis of your condition. The moment you ask the question why, that at that moment in time, I advise people to be able to now seek professional help, because if you miss that point and decide to brush it under the carpet, it will continue affecting you in such a way that it will just continue affecting you day in, day out, day in, day out. Then subsequently, it will affect you at your place of work and at your social events. Maybe you're hanging out with friends, it will start affecting you at that particular point. It's going to affect you at a family level. Maybe within your family, your spouse and your children, they start noticing something is different with you, and your response to situations is different with you. Same to your workplace. So it start affecting your productivity at the end of the day. So the moment you start asking the question why, seeking help at that point will help in reducing the progression of this condition. And the same applies to depression, because when you feel a change in behavior from the way you were before, you are a happy person, you're always joyful, you did your things cheerfully, you talked to people, you went to social events with people, your relationship with other individuals was good, then all of a sudden you start noticing that your behavior has changed. You feel like you need to be alone every time. Your thoughts are becoming different nowadays. They're no longer happy thoughts. You're thinking about bad issues. All of a sudden you're contemplating things like suicide. You're losing interest in the things that you used to love. If you're a football fan, you used to go to joints on a weekend just to watch football. You felt happy being among people. Nowadays you just feel the need to just stay alone, stay secluded all of a sudden. So you as a person have noticed that change that is happening to you. Seeking help at that point becomes very key, because now the healthcare professionals will try and help you to be able to cope with whatever that has tipped you over to depression. Yes.
Okay. Thank you so much for that. And Daktari, you'd realize that so many people, from the classification, actually from the report that was given to the president in 2019, and of course we may want to talk to somebody someday soon about the actions that were taken, because so little has been done out of the report. You'd realize that actually anxiety disorders were coming in at number 2. But then let's look at our society today in terms of classification. Maybe what is the commonest cause of anxiety among the people we see in our institutions today?
So of the anxiety disorder, generalized anxiety disorder was classified as one of the most common ones among people with anxiety disorders. But we have other ones, like the one I was talking about, panic disorders, separation anxiety disorders, that also, there are different kinds of anxiety disorders that affect different kinds of people. So as I was talking about earlier, the causes can be both environmental or experience or innate. Something that you're born with, that you can be able not to be able to handle it, or experiences that have made you pass through make you have anxiety disorder. For example, you early in your life you passed through a traumatic event whereby you were trapped in an enclosed room, in an enclosed space during a traumatic event that was happening to you. And then after a while, when you get older or when you're advancing in age, you find yourself that you cannot stay inside an enclosed room completely. Or maybe you are involved in a terrorist action or activity. So when that happens and you found yourself hiding in a closet, and then every time you enter into the closet, you just panic, you lose your breath, you cannot breathe, and things like that develop into anxiety disorder. So some of these environmental or experience factors that come in when you have anxiety disorders also can overlap with things like post-traumatic stress disorders that come into play when you're having traumatic events. So the causes of anxiety disorders become very many for different kind of individuals. That is why you see its classification being its commonness being higher on the list as to compared to things like schizophrenia. Yes.
Okay, thank you so much. And of course, I will now be heading to drug and substance abuse, unless there's anything else you'd want to add on the, on the anxiety disorders. Of course, these are just eye openers that there is a conversation we need to have about our mental health. Of course, Social Square, which is tomorrow, provides a better chance for us to talk about it now in a practical setup. There's where we can get even testimonials from people who've healed. And there's actually Liz Rock here prescribes that you look for professional help. She says at times you talk to someone and they start telling you how strong you are, you can manage it. Others tell you you don't even look like you're depressed. So I think the right thing then, as much as you may want to start from people who are really close to you, she prescribes that it's just also okay to directly go to a professional, because they'll not end up, they'll not start telling you things like huko na nguvu wewe. Okay, Daktari, as we had, I don't know if I can get another one here. Somebody says a very productive discussion. We need to hear more of these. Now I'm thinking realistically. CK Kim says getting you loud and clear. There is Berur KE says good morning. There is Tobias Ocho who says he's tuned in. I think I'll continue sampling some of these comments as we continue to move. Nonetheless, I would just want to remind you that you walk into D-Square School of Fashion Design to make sure that you master the art. If you're actually interested in fashion, currently D-Square School of Fashion Design and Tailoring are situated at the fourth floor of Ketia's building in the Eldoret CBD. So if you're interested in learning fashion and design, and other courses related to fashion and design, then consider walking into D-Square School of Fashion Design. Of course, there are courses that are as short as 6 months, then there are those that go for 1 year. And all I can assure you is that the sweetness of starting from there, apart from the pocket-friendly school fees, is that you get first-hand experience from tailors and fashion designers at D-Square Fashion House. And now I'm moving forward to drug and substance abuse. This reminds me of science at standard 4. I remember there was HIV and AIDS. Then the next topic was actually drug and substance abuse. And you'd realize that for every I would say abnormality that strikes our society, so many people, educationists and other people, you would end up saying that maybe we should include this in the curriculum. You'd notice that drug and substance abuse has been part of our curriculum, I think, for quite some time. You'd read it in primary, you still find it in high school, kwa chemistry and all that. And it seems the more we understand, the better you want to experiment. First of all, Actually, before we go to the professional bit of it, where do you think we cut the line? Because is it a cultural issue? Is it a societal issue? Where do you place it before you become a doctor? And before you answer, Daktari also told me he goes to church, so there's also that bit of it. I remember there's a school, there's a story for another day, or maybe I'll tell you at the end of the broadcast. But then somebody who I ever prayed for because they were drinking alcohol, and so the next day they were coming for prayers, they came in drunk. Anyway, next time it's your time.
Yes, Kalia. So it's how can I say it? It's going to be hard to answer that after such an introduction. So yes, is it a societal issue? Yes. Is it an experimental issue? Yes, it can be. Because how can I put it? Society or makes it cool to feel that you're abusing drugs. You see, yes, it's been part of our curriculum for as long as I can remember. Just you saying class 4, standard 3, standard 5, science, talking about substance abuse. You see the diagrams being done there of people sticking needles in their hands, the effects that they have. You're taught about alcohol, the effect that it has at a very early age, 10 years, 8 years, 9 years. But still, when you get to teenage, you want to try it out also. Somebody is typing, even doctors drink. You still want to try it out when you're 15. You see, I want to feel what people are actually feeling. So yes, it has been educated out there for quite expressively, I can say. The training and the teachings that I've gotten out there, not just in school, but also in our religious institutions, has been extensive. Most religious institutions will actually condemn people from taking alcohol or using substances. You come to school, the same is being done by your teachers. You go at home, the same is being done by your parents. But at the end of the day, people just seem to ignore all this and abuse drugs. So the keynote here is, yes, people take substances into our bodies, be it alcohol or other harmful substances into our bodies, which entails also prescription medications, which people tend to not really know about. Even prescription medications is part of substance abuse. When you're given prescription medication by your doctor and you abuse whatever they have given to you, that is classified as substance abuse, using it for recreational purposes. So alcoholism ranks high on the list. Is this a societal issue, or is it because of availability of alcohol, or is it something cool? You traditionally associated with, the wazés take alcohol. So if you take alcohol, you classify it as part of being
in fact, inaitwa vitu ya wazee.
Yeah, inaitwa vitu ya wazee. So if you take alcohol, you're classified as part of wazee. So abuse comes into play when it becomes excessive. So excessive alcohol intake. Even in the adverts that they give, when they're giving it to media outlets, they write down there excessive alcohol use is harmful to your health. You have to understand that cigarette smoking is harmful to your health. They always put that disclaimer down there. So substance abuse, apart from it affecting your physical health, has a key implication on your mental health. Because excessive intake of alcohol over a long period of time has effects on your brain. It can lead to brain atrophy, that can lead to things like dementia, which are brain conditions. It can lead to things like liver cirrhosis, which affect the liver. You can get other non-communicable diseases like cancer that come into play when you're taking alcohol abuse. But today you're going to talk about its mental effects on people. So you'll come to realize when substance abuse becomes primacy. What do I mean by primacy? Primacy means it becomes the only thing you think about. It becomes the driver of your day. When you make a little bit of money, the thing you're thinking about is, can I get something out of it? Whatever you're making, you're taking to substance abuse. Most commonly, alcohol. Now that becomes a mental issue. And that becomes a mental health disorder. Because if you're a breadwinner in your family, and whatever penny that you make, you take to alcohol use, and nothing is developing or going towards your own personal growth or your family growth. So that to the point that even food is no longer a priority to you as compared to alcohol use. Now that becomes abuse and substance abuse. So many people, the reason why it's very common is that many people start it at a social event, something they do for fun. Me and my friends are going out, we need to take something, a drink. Me and my friends go out, we need to take a drink. But the association of substance abuse with other mental health condition also comes into play. Some people will be now at this particular point can no longer handle or can no longer control themselves. So what happens? The commonest example we give is someone with depression. I know we keep going back to it. The commonest example is someone with depression. You are feeling sad, you're feeling lonely, you cannot handle the situations, the stressors of life around you. So what do? You turn to substance abuse. So if you're a smoker, you do 3 packets a day. If you're an alcoholic, you make sure that every morning you have an opener, just to make you try and help you forget whatever you're feeling.
Hiyo ndio kutoa lock yenye umeita opener. Okay, sawa.
You have an eye opener. So you're taking alcohol to try and dampen the mood or the feeling that you're having. Or you're shooting needles on your arm to try and help you tackle the stressors of life. So you'll come to notice that substance abuse is getting commoner, but now because of because of negligence to the other conditions like depression that affect individuals, it has made substance abuse even worse. So we in the health profession, we usually come to notice, or you come to realize that when you're helping someone with substance abuse, then you find out actually the trigger of his substance abuse is because of this person is suffering from depression, or this person is suffering from bipolar mood disorder. He has a form of mood disorder. So him taking alcohol, him taking other hard drugs, or taking prescription medications is to try and get away from this feeling. So when we start helping these individuals from not taking substances, we are also forced to help this individual understand and help them to tackle depression, why they are doing it. So there are people who are social drinkers. Maybe once in 3 months when they go out, just maybe take a glass of wine or a bottle of beer, maybe once in 3 months, once in a month. They're not really doing it as a way of coping with life. Then there's someone who is going to take it every day. Now that someone who is taking it every day is suffering from a mental health condition. And you'll notice if you ever sit down with them or you talk to them, you'll notice that there's something that is triggering them from taking it, that is triggering their behavior of taking it every day. If they're not having depression, it might be because of dependency. Your body now is demanding for it because you abused it so much. So your body is just demanding for it every day. You cannot do without it. That's the point now. It becomes the primary thing that you want to do. You become over-dependent on it. You want to stop, but you're feeling, no, I can't do without this thing. So substance abuse becomes a mental health condition that actually needs tackling. People need to seek help. When you're when you're an alcoholic and you cannot help yourself to take it, you need to seek help from a professional who will help you, one, to stop from the drinking, and also help you not to go back to it again. Because many people slip back to it. Now that's where things like, when you talk about psychotherapy in substance abuse, that's where things like anonymous groups come into play. Where someone sits down with people who have been suffering from the same thing, and they're helping each other in be able to tackle the condition that they have. So you have things like Alcohol Anonymous, people sitting down, talking about their condition, trying to remove the craving of it. Because the substance that you're abusing, your body craves for it. So tackling it also entails pharmacotherapy, at the same time it entails psychotherapy with counseling that comes into play. And there are very many different kinds of substances that people abuse. It's not alcohol alone. Alcohol is high on the list, but there's cigarette smoking, there's hard drugs, you have cocaine, you have heroin, you have meth that people are exposed to. So all these drugs that are abused out there, we have prescription drugs as I was talking about. Maybe someone is hooked on painkillers, hard painkillers like opioids that they cannot stop from taking them. So at that particular moment in time, you need to seek help. Maybe you suffered an injury. So there's some people who, unfortunately, they suffered a major injury. Maybe you suffered you got an accident, you got very bad fractures. The pain was extreme. So we doctors give medications to help and control this pain. And some of these medications can be classified as opioid medications to help you tackle the pain. But you have to remember that doctors or healthcare professionals, when they prescribe these medications, they prescribe it at a limit. We usually prescribe these medications as we help you tackle the pain, knowing at what point you need to stop those medications. Then now there are some individuals who cannot stop and now get access to these drugs in one way or the other, because they're becoming dependent on it. You find your doctor has written for you 1 times 2. for 2 weeks. And after 2 weeks, he tells you that's enough. At this point, we can stop the opiates. The other medications the other painkillers can tackle the issue that you're feeling, because that acute pain is now over. But you yourself decide to go, let me go and buy it from a chemist, or let me go and buy it from a peddler. You go and buy and self-medicate yourself. At that point, you become hooked to those medications. Now, when you become hooked to those medications, you'll still suffer the same trail that people maybe say who are taking alcohol suffer. So the point that if you don't take that tablet in a day, you feel so much pain. That is not there. Psychological pain.
It's a pain that doesn't exist.
It's a psychological pain. Your brain is telling you this leg is really painful. Yet the wound has actually healed. You're walking very well. Then when you take just a simple tablet, you feel so okay. So it becomes a psychological pain. So prescription drugs can also be abused. So when you tend to see yourself falling into such kind of behaviors, it's very important to seek professional help. There are medications that we can give to help people get unhooked from the drugs that they are taking, and also psychotherapy come into play. Because as I said earlier, these mental health conditions, their effects are devastating not to a single individual, but to the whole community and the whole society at large. So when we don't tackle them early enough, the effects that will be there for each and every, it's going to touch someone else's life at a given point. Yes.
Okay, thank you so much. And of course, when you talk about all these conditions, you realize that at the end of it all, it ends up into, just as Daktari says, it ends up affecting the lives of more than just the individual who is suffering from this. Now that we've talked about all these, and it looks like also time is giving us the buck. Daktari, where does who does the buck stops with, if I may say so? Of course, today this looks like a social show more than it is yeah, Daktari. But then, of course, at a clinical level and also at a personal level, we've talked about this. And there's somebody who told me the other day that if I don't take care, then we'll talk about very important things, but then we'll also need to look at the resolution bit of it, solutions. From where you sit as a doctor, there's somebody watching you right now who is maybe in depression, in anxiety. You've given, of course, but then what is that one advice that you give for
those kind of people?
Yeah.
So, yes, with your first question, who does the buck stop with? I will always say the buck stops with an individual and the society at large. When we give this awareness to people, you have to understand that the people suffering from these conditions might notice they have it, but they fear going to hospital. So first and foremost, you have to accept whatever you have, whatever you're suffering from, as a medical condition. This is something that you're suffering from. Treat it like the way I'm suffering from malaria. I need to seek help. If I don't take help, this can lead to my death. So for someone, let's say depression or substance abuse disorders, if I don't seek help, this can lead to my death. So I need to seek help. So the buck first stops with
the individual.
With the individual. Then also the society. The reason why we are enlightening people, the reason why we are giving this kind of awareness, the reason why the world at large is creating mental health awareness days, we have so many people talking about it, is because we are trying to make people understand this condition so that we can stop the stigmatization. Because what is destroying people's life out there is stigmatization. People are really when you discover that an individual or a friend of yours or your colleague or even your relative is suffering from a mental health condition, you are treating them different from a relative who is suffering from a disease like diabetes. You see, how you take diabetes and how you take, say, depression as a society out there, is that there's a very big difference. Someone with diabetes, you leave and tell them, end hospital, endo kapatiwe dawa. Hii tunaweza saidia we. But when you feel someone has a change in behavior that is tipping towards depression, unamwambia, ni stress tu ya maisha, relax tu. Utamanage bana, hata hizi vitu si tunapitianga. We relax tu. So when you do that, remember this person's ability to tackle the kind of stressors that you are both exposed to is different. We are both exposed to stressors in life, be it financial stressors, be it family stressors or social stressors. Our response to it is different. There's someone who will respond by laughing and joking it around and just brushing it off and getting on with life and tackling it head on. There is someone who that wind will blow him over to the point that he cannot be able to tackle it anymore. So when you tell this individual where kanyagia hii story
kuwa mwanaume bwana.
Kanyagia tu hiyo story, we angalia tu, utamanage tu. When you tell someone such a statement and they don't go to seek help, then this person down the line ends up committing suicide. Then you're left wondering, what happened? Kwani nini ilikuwa mbaya? Then when that happens, the buck stops with us as the society. We want, the reason why we are giving all this awareness is that we want it to become easier for you to refer an individual to seek professional help or healthcare help if he's suffering from a mental condition, as it is easier for you to refer someone suffering from hypertension. That is the point. The way it is very easy for you to take someone with malaria to hospital to seek treatment or diarrhea to seek treatment, we want this also to become easier for you to take someone or a colleague, a friend, a family member to hospital because they're suffering from something like depression. Most of the times, I didn't talk about schizophrenia, but you find most of the time the family members will take someone to hospital if they're suffering from psychosis, which is a form of schizophrenia, if they're suffering from psychosis, because the symptoms are overt. Sasa ameanza kutusumbua nyumbani. Hashikiki, anaharibu TV, anaharibu vitu, anavunja kila kitu. You're wondering what's going on. Mnamleta hospitali. You see? But someone sitting alone, he doesn't seem to have lost interest at work. His job is falling down. You talking about him instead of talking to him to help him to seek help. So that change in behavior needs to come into play. So yes, the buck also stops with us as a society. So when we tackle these things head on, when we change our mentality and our behavior towards it, and these people seek help, then we'll find out that the incidence of avoidable situations like depression can go down. The incidences of avoidable situations like substance abuse can go down. Yes.
Okay, a friend of mine called Jude says that they're waiting for a time when people will fundraise to take somebody with mental illness in the hospital because we've been fundraising for physical health for too long. Of course, like all the other question, maybe I may need to ask Daktari how much of insurance takes in that way, because when he brings in the issue of fundraising. Anyway, I really don't know how much therapy is expensive. There's a colleague journalist who actually committed nowadays when we report suicide also we are told you don't say they committed suicide, you just say they died of suicide related, or they died of maybe mental related in whatever, so you say they died by suicide or something like that. So people don't commit suicide actually. It is the disease in them that pushes them to the wall, and that is when they commit suicide. And there's somebody who then died by suicide, and they were a journalist, and in their suicide note they wrote about the cost of therapy being so high. It's an issue to talk about it someday, but do you think it's also one of those reasons? How willing are insurances to cover mental disorders? Okay, except the one that you've said, it's too obvious. We're talking about now depression, anxiety, and even rehabilitation for drug and substance abuse. Do we have insurances that are readily willing to cover such?
Yeah, there are insurances that are willing to cover these conditions, that help to cover these conditions. When we diagnose them and we disclose them to your insurer, the kind of help that they give you, your psychiatric care is covered by these conditions. Yet outside there also there are very many individuals who are not covered by insurance. Very many individuals in the country are not covered by insurance. That's why it's becoming, universal health care is becoming the talk of the day nowadays. From 2013 onwards, everyone is talking about every government is talking about universal health care to try and make healthcare affordable to individual. Because of the length of stay and because of the length of treatment that comes into play when you're suffering from a mental health condition, now the expenses also go up. Just like maybe say chronic conditions like cancer or diabetes that entail you going to hospital and seeking help each and every time. Mental health conditions also their length of treatment is also long, because I told you things about psychotherapy, pharmacotherapy, whereby you need to take the drugs. Yes, insurances are coming into play to help individuals suffering from these conditions be able to seek help. Most do not discriminate from individuals. They do cover for those mental health conditions, but the out-of-pocket expense has also become high because of the length of pay that people are taking. And because most individuals in the country are not covered by health insurance, now that's why the expenses are going up. Now at that point, now it becomes part of at that point, now we say the buck also stops with the government in making accessible care easier to individuals. Because if we end up creating a task force to help educate about mental health, we need to understand the financial implication behind it, and what is the government willing to help its people in be able to tackle the financial bit of this condition. Yes, the healthcare professionals are there. Yes, insurances are there, but the cost is still too high. So where does it come into play? Because when you give figures of 1:8, 1:4, those are very high, very high numbers. So now at that particular point in time, that's when now the policy makers will have to be able to come in and chip in and see how they are going to help elevate the cost, be able to help reduce the burden of the cost so that people can be able to seek help. It becomes very sad when a colleague of yours, like a journalist, commits suicide because the expenses have become too high. Maybe they were suffering from depression and they were going under treatment. Now the cost has become too high. They're thinking the burden to the family is too high. Why don't I end this problem to my family? So we lose a bright mind because of financial reasons. So now that's the time policymakers have to come in, insurances have to do more and be able to tackle this condition. That's so as I was saying earlier, as we are ready to and prompt to be able to tackle someone with a physical condition, let's have the same readiness and promptness to tackle someone with a mental health condition and be able to help them. Yeah.
And of course, Jude's point then is a very valid point that we may actually need to very soon start fundraising for people who have mental diseases. In fact, he continues to say that when somebody starts, okay, for him he calls it madness. I know you could give it a different name. When somebody starts showing signs of madness, you realize that the whole community comes together to even help the family, put them in the car, and you'd even find two men willing to accompany the family to hospital or make sure amekwama kwa gari. But then when it's depression, nobody talks about it. Anyway, it's a topic for another day. Maybe we'll call you on the social square. Actually, tomorrow we have something called social square on Thursdays, where now we talk more of based on a societal point of view, because we realize that this is an issue that also really needs a lot of input, even from government and all that. Nonetheless, I would have to ask you for your parting shot, because already I can see Constance Neema is already standing up, just signifying me that, bro, if you don't stop, I'll stop.
Yes, yes, Neema. We are about to finish. We are about to finish. So the take-home message will be one: let's not stigmatize individuals with mental health condition. And secondly, if you're suffering from any mental health condition, make it a health-seeking behavior, make it easier or a habit for you to seek medical help, because these conditions are manageable. These conditions are manageable. The healthcare workers have been trained enough to manage these conditions. So it is up to us, the society, and individuals who are suffering from these conditions to actually seek help. So for me, I would just encourage everyone to seek help and everyone to be your brothers or your sisters keeper and be able to understand these people and be able to direct them towards the path of seeking help. In doing so, we'll be, what we say, raising a healthy generation. Because as I said earlier, health is not about physical health. Mental health also plays a key role. So if you want to raise a healthy generation, we should not just tackle the physical bit. The mental health also has to be on point. Yes, thank you.
Thank you so much, Dr. for always making time to be with us. It is 7 minutes past the hour, 9 a.m. And with us has been Dr. Mwadime from Topil Hospital. And of course, Topil Hospital is a brain and spine facility situated in Elgon View, Eldoret. But then as much as they are they really specialize so much in brain and spine. They also have all the other clinical departments. So if you need any kind of attention, remember that there's a level of 5 hospital that can take care of you within Eldoret town. That is Topil Hospital. And so with that, then thank you so much for making time to always also watch this particular broadcast. Thank you so much for the many questions. I know there are comments I didn't read, but then at the end of it all, we really value you. I can see my friend is still texting me some facts. I think next time he needs to come in a little bit early. Very interesting questions, but then now time ishatuacha. And nonetheless, also allow me to remind you that March is here, April is coming, and also May is coming. And you say that if you want beautiful memories of those weddings, book with the Dawi Afrique Photography. Dawi Afrique Photography makes sure that you receive well-documented images and motion, what you'd say, videos of your event. So if you want well-documented memories, consider working with the Dawi Afrique Photography. My name is MC Kali, and on behalf of everyone that made effort to bring you this particular broadcast, Constance Neema and Kimtai Wilbert and other producers, then thank you so much and see you tomorrow.